One.
Greetings, my name is Dr. Jack Einhaber, PhD. The purpose of this video is to introduce a plan for a universally acceptable partial but significant solution to many of the major deficiencies in the United States and worldwide healthcare systems. The proposed program would provide higher quality medical care through substantially reduced medical errors and improved prevention. It would also provide increased efficiency and lower healthcare costs via quicker, more accurate medical visits and focused, accurate selection of necessary medical testing while decreasing unnecessary testing. Increased efficiency and cost savings will make such safer, truly high-quality care available to many more persons. There is a potential to vastly expand our medical knowledge and match patients suffering with complex illnesses to esoteric or knowledgeable specialized physicians. It's a non-political, simple and sensible scientific approach readily understandable to non-medical or lay persons. It's compatible with any healthcare system, including both previous United States healthcare system and the Patient Protection and Affordable Health Care Act, also known as Obamacare. It's also compatible with single-payer systems such as that of Canada. The system the proposal is timed to provide common ground between United States Republicans and Democrats in order to help prevent differing approaches to healthcare from causing future government gridlock. Details follow in subsequent videos, but essentially the way the proposed system would work, and this will be detailed in the next video using the diagrams behind me. So essentially the way it would work is to administer a financially incentivized, and this will be explained, culturally oriented symptom questionnaire which patients would complete at home prior to the medical visit. Questionnaire results would be filtered through a computerized database of our existent medical knowledge. Those outcomes would in turn be further individualized by cross-referencing them with secured patient computerized medical records, or if unavailable, then the patient's self-described medical or health conditions along with family medical history. The purpose would be to glean potential causative conditions and the program's recommendations for suspect causes, tests, and measures to be taken, including treatment options where appropriate. The computer's recommendations would be interfaced with the patient's computerized pharmaceutical profile to reduce the incidence of medication errors. Eventually, the same would be done for supplements at commercial outlets. So what would happen is that by the time the patient enters the doctor's office, and this could even be adapted to emergency room situations if time and circumstance permit, the computerized printout would already be available to the doctor once the doctor sees the patient. This would eliminate a lot of the questions and probing that the doctor would normally need in order to draw information out of many patients. This would reduce visitation time needed and eliminate a lot of errors due to factors briefly described above and which will be detailed in subsequent videos. Thus, the system would act as an advanced, objective second opinion, not subject to the many foibles which plague humans. An important benefit would be reduction in the frequency of medical malpractice and its effects on medical malpractice, on the medical system. There would be less actual malpractice due to fewer errors. Fewer physicians would abandon their practices due to the support of such a system, which in a sense would function as an advanced second opinion, as well as a guide for the medical visit. And in many cases, the program would make recommendations for the hands-on physical examination. Now, the system could be adapted for general prevention and could generate its own database, which would vastly increase our medical knowledge and have certain lifestyle suggestions, which could be extrapolated from evidence-based probabilities. Now, and if these are followed, this could reduce the incidence of future disease and its concomitant load on the medical system. The system could also create jobs and reduce emergency room clutter. But to really understand the system and its implications, you really should view our 4 detailed subsequent videos, including a dramatization. The information gained, or the information that is the foundation of the system, comes from the application of my very excellent education to my hard-learned experience. I've spent about 1.5 years of my life hospitalized in more than 15 medical centers. And if you count my medical encounters all together, I've been treated in probably about 30 cities worldwide, 7 different countries, approximately 10 states, 2 Canadian provinces, had over 100 surgeries, been told 6 times that I was going to die anywhere from within 5 years to a few weeks, and was actually dead on the table during a liver transplant for a very rare, non-communicable illness, orphan illness. So, literally, this is a vitally important undertaking whose implementation plan will be discussed in the 3rd video. But it's a plan that can be applied to other major changes that are necessary for the survival and optimal functioning of our society and the world. I look forward to your participation, and I want to thank you very, very much for listening. Goodbye.